Hello and welcome to today's webinar presented by National Academy for State Health Policy. My name is Susan and I'll be your operator for today's call. Please note that this conference is being recorded and all participants are in a watch and listen only mode. You can ask questions using the Q&A bar at the bottom of your screen below. And if you require technical assistance, please also reach out using the Q&A feature. It is now my pleasure to turn the call over to the moderators of today's webcast, Jill Rosenthal. Take it away, Jill.
Wonderful. Thank you, Susan. And welcome everyone to our webinar. We're excited to host today's webinar focused on flu because this year, even more than ever, flu vaccines are critical to keeping the population healthy. And strategic planning for this flu season during the COVID-19 pandemic is critically important to ensure states do not experience dual epidemics this year. I'm Jill Rosenthal. I'm a Senior Program Director at the National Academy for State Health Policy. And for those of you who may not be familiar with NASHP, we are a nonprofit, nonpartisan organization of, by, and for state health officials dedicated to helping states work across agencies and branches of state government to find solutions to the state's most pressing challenges and advancing innovations in state health policy. This work on preventing flu during the COVID-19 pandemic squarely fits within that mission. We have a fantastic panel of speakers today, and after introducing them, I will give some very brief context, and then we will segue into the panel and save some time for Q&A at the end using Zoom's Q&A feature. So we're fortunate to welcome three distinguished speakers. We have Dr. Sam Greatzer, who is Medical Officer and Pandemic Influenza Coordinator at the Centers for Disease Control and Prevention. Dr. Greatzer has served as Deputy Director of CDC's Pandemic Influenza Vaccine Task Force and worked on a number of seasonal and pandemic influenza and adult immunization issues while at CDC. Next, we will hear from Jamie Snyder, who is Director of the Arizona Healthcare Cost Containment System, overseeing Arizona's Medicaid and CHIP program, including the provision of acute behavioral health and long-term care services and supports. And then last, we have Dr. Ngozi Ezike, who is director at the Illinois Department of Public Health and a pediatrician who has delivered inpatient care, primary and preventive care in community and school-based clinics, and is a national policy advisor on juvenile correctional health topics. Dr. Ezike at this very moment is briefing the governor on the pandemic response in Illinois. So she is not going to be able to join us live, but she was gracious enough to produce a video presentation that we will show following Jamie's presentation. Next slide, please. Today's webinar is supported by the Centers for Disease Control and Prevention as part of a project in partnership that NASHP is doing with Academy Health and Immunize Colorado to support states in increasing immunization rates among Medicaid-covered children and pregnant women. Over the past 3 years, we've partnered to support states in identifying solutions to immunization gaps and making progress toward immunization goals by engaging and communicating with state Medicaid leadership, sharing best practices, and enhancing collaborative efforts across state agencies, with the recognition that partnerships between immunization programs and Medicaid programs are necessary for reducing income-based disparities in immunization rates. Next slide, please. As part of our project, we've provided focused technical assistance to 5 states: Colorado, Hawaii, Kentucky, Montana, and New Mexico, and identified barriers and successes to increasing immunizations. Multidisciplinary teams made up of Medicaid, immunization programs, and immunization information system staff have participated in each state. Through the project, these states have strengthened their data infrastructure and data exchange capabilities, onboarded new immunization providers, and enacted legislative and Medicaid policy improvements to promote immunization. More information is available at the link that is provided here. Next slide, please. While flu vaccines are recommended for everyone at least 6 months old and are free of charge to people with insurance as the result of the Affordable Care Act and for uninsured children through the Vaccines for Children program, we know that annual flu vaccine rates vary widely across states and by demographic factors such as race, ethnicity, and age. And a recent CDC study suggests that flu infection during pregnancy may result in increased risk of pregnancy loss and a reduction in birth weight, and recommends that flu vaccine among pregnant women, which has been and recommends flu vaccine among pregnant women, which has been shown to prevent flu illness in the mother and the baby after birth. State health officials across agencies are tuned into the need to ensure equitable access to the flu vaccine, including expanding access to immunizations through pharmacies and other delivery sites to reach vulnerable populations, and various payment and reimbursement strategies available. We know that states have a variety of levers at their disposal to prepare for and address the flu season, and that efforts to promote flu vaccination could be informative in preparation for how a COVID-19 vaccination could be administered across the country. Today, we have the opportunity to hear from the CDC, who will provide a national overview of flu prevention priorities and a closer look at state strategies in Arizona and Illinois. Our panelists today point to the critical need to prevent flu and ways that both public health and Medicaid agencies can use various tools and resources to serve their state's residents. Before we get started, I just want to remind you that you can ask questions at any point by typing them into the Q&A feature, and we will do our best to get to as many questions as possible. And now I'd like to turn it over to Dr. Greatzer.
Hi, everyone. Thank you for having me on the call. It's a pleasure to be here, and it's great to be part of this panel. Again, my name is Sam Greatzer. I'm a medical officer currently on the vaccine task force at CDC and part of the influenza team. Next slide, please. As many of you know, influenza has a tremendous impact on healthcare in the US every year. In fact, CDC estimates in the 2019-2020 influenza season, flu caused approximately 38 million illnesses, 400,000 hospitalizations, and more than 22,000 flu deaths, mostly in the adult populations. Next slide, please. Influenza vaccination, as you know, is the best way to protect against influenza disease. While only half of the population got vaccinated in the 2019-2020 season, this still had a tremendous impact in preventing a number of illnesses. We estimate that influenza vaccination of 50% of the population reduced 7.5 million flu illnesses, 105,000 hospitalizations, and more than 6,300 deaths. Our goal is to increase vaccination far beyond 50%. Unfortunately, vaccination coverage remains low, especially in subpopulations. Next slide, please. This slide shows influenza vaccination coverage by age groups among adults in the United States for the last 9 years. While you can see that influenza vaccination coverage among those 65 years and up is highest at around 69.8% last year, it is still extremely low among younger populations, in purple, persons aged 18 to 49, even those with high-risk conditions that are not pictured here. Next slide, please. There's also substantial variability of vaccination coverage among states. This slide shows coverage by state among adults for the last season. On the left are states with lower influenza vaccination coverage among adults, and on the right are states with higher vaccination coverage among adults. Nevertheless, even states with higher vaccination coverage are still far below where we need to be and below the Healthy People 2020 goals. Next slide, please. We also see substantial disparity among racial and ethnic groups among adult influenza vaccination coverage. This slide shows vaccination coverage by racial and ethnic group for adults in the last 9 years. While whites, non-Hispanics have higher vaccination at 52.8, there's substantial disparity. Hispanics have the lowest vaccination coverage at 38.3%, and African Americans at 41.2%. Next slide, please. Addressing these barriers and increasing influenza vaccination is especially important this year, but unfortunately much more complex because of the COVID-19 pandemic. Next slide, please. It's not uncommon for epidemiologists to look to influenza activity in the Southern Hemisphere to predict influenza activity in the Northern Hemisphere. This year, Southern Hemisphere influenza activity is reported at a much lower rates than have been typical in prior years. Fewer countries are reporting data and fewer viruses are being detected. Social distancing and other preventive measures to reduce the spread of SARS-CoV-2 may also have helped reduce the spread of influenza viruses. The COVID-19 pandemic has also influenced health-seeking behaviors and testing priorities and capacities of providers and health departments, making interpretation of our typical surveillance systems more challenging this year. Next slide, please. So it's unclear what impact the ongoing pandemic will have on the upcoming influenza season in the US. There may be less flu than usual because of social distancing and other measures to reduce COVID-19. Influenza viruses and SARS-CoV-2 may co-circulate. People may be co-infected with influenza and SARS-CoV-2. And the presence of SARS-CoV-2 and influenza at the same time could place tremendous burden on a healthcare system that's already reaching its tipping point and may result in many prevented illnesses, hospitalizations, and deaths. Next slide, please. We expect SARS-CoV-2 to continue to circulate, unfortunately. Because of this, increasing influenza vaccination coverage is an important part in reducing the overall stress on the healthcare system in order to decrease doctors' visits and hospitalizations, but also reduce diagnostic testing, especially among influenza. There should be a special focus on reaching adults at high risk for COVID-19, though all persons are recommended above the age of 6 months of age for influenza vaccination. Special populations include staff and residents of long-term care facilities, adults with underlying conditions, African Americans and Hispanics and other groups disproportionately affected by COVID-19, and adults who are part of the critical infrastructure. Next slide, please. This year, fortunately, there's more than 190 million doses of flu vaccine in the market. In order to make sure that all these doses are used and they get the best effect, there are a number of considerations that we should take into account. We should ensure that there is outreach to those that are higher risk for flu complication, that providers are planning the need for social distancing and physical distancing in their clinics, and that they're planning for extending influenza vaccination throughout the entire season, even beyond December. And then there is a need for enhanced communication. Communication should ideally align with COVID messaging and take this opportunity to also emphasize the importance of influenza vaccination and to increase messaging for high-risk individuals as well. Next slide, please. There are a number of barriers to flu vaccination this year. There may be fewer vaccination clinics, particularly worksite clinics. People may not feel safe going to clinics or pharmacy settings where they used to get flu vaccine. In-person clinic visits may be canceled or may have moved to telehealth. There may be concerns about the safety of the COVID vaccine, which could translate to more questions about safety of flu vaccine. COVID-related unemployment may impact the ability to afford flu vaccination. And working parents may have limited time to focus on vaccination of themselves, but also their children. And people may not think that flu vaccine is as important this year because they are social distancing or wearing masks. Next slide, please. Now, there are a number of steps that we should take to try to overcome these barriers. This includes coordinating the messaging of with CDC's communication for flu vaccination among provider groups, health departments, medical professionals, and other groups on the importance of flu vaccination. Patients need to know that the providers are taking protocols and putting them in place to ensure that they're safely administering vaccine. We need to think about implementing creative approaches to address address access and disparity issues and common misperceptions about flu vaccine. Providers need to be able to share information. This is particularly important to this group, but to share information on Medicaid and Vaccine for Children's program, insurance subsidies, and other payment options for patients who may have recently lost insurance coverage or experiencing economic hardships. And lastly, providers need to make sure that vaccination efforts continue, again, as I said before, through the duration of the flu season. Next slide, please. This year, CDC has implemented a number of guidances for providers and healthcare facilities to safely provide immunization services in general, not just for flu vaccine. This guidance correlates with our framework for providing non-COVID clinical care and includes considerations for use of PPE and considerations for various clinical settings for vaccine administration this year. There's special focus on priority populations for flu vaccination, including those at high risk for flu-related complications, but also those at high risk for severe COVID-19 infections, which these groups tend to overlap, and also special focus on essential workers. And I've included the link to the guidance here. Next slide, please. Providers need to implement enhanced infection control measures, as I mentioned before. Providers should make sure that there are processes in place to screen patients for symptoms before and during the clinic, that there are physical distancing features in place at the clinic, that they limit and monitor facility points of entry and install barriers to limit physical contact for patients in triage or in waiting rooms, that respiratory hygiene is an important part of the clinic so that all staff wear face masks and face coverings, including for patients as well, and that cough etiquette is maintained. Hand hygiene is important as well, including at least 60% alcohol hand sanitizer, and providers need to implement enhanced surface decontamination in their clinics. Next slide, please. As far as PPE, we recommend that all healthcare providers providing vaccines this year wear a face mask. For providers providing vaccines in areas with moderate to substantial community transmission, which unfortunately is most of the nation right now, we do recommend eye protection as well. Gloves are considered optional for intramuscular or subcutaneous vaccines, but recommended for intranasal vaccines and oral vaccines, so there is the oral flu vaccine this year. Next slide. And again, ensuring physical distance is particularly important. These are just examples provided to providers to think about methods to separate sick and well patients in the waiting room, ensuring physical distancing, that there are strategies such as barriers, signs, ropes, and floor markings so that patients are spaced out throughout the clinic, but also reducing waiting room interaction. So some patients may be asked to wait outside or in their vehicles until called. Next slide, please. We've also, for vaccination providers who are providing vaccines outside of a traditional setting or a doctor's office setting, we've implemented guidance for vaccination clinics held at satellite, temporary, or offsite locations. This is just a screenshot of the website and includes links to planning activities, pre-clinic activities, activities that are conducted during the clinic, and post-clinic activities such as ensuring that vaccine doses, the data for vaccine doses are reported to Immunization Information System or vaccine registries. Next slide. This website also is linked to the checklist of best practices for vaccination clinics held at these settings. This is an important tool for providers and clinic planners that links to a number of CDC guidances regarding transport, storage, and handling of vaccines, safely administering vaccine, and documenting vaccines in the vaccine registry. Next slide, please. There are a number of flow charts for various clinic layouts. This is an example of a clinic layout for an indoor or outdoor walk-in clinic. Next slide, please. There's also flow charts for curbside or drive-through clinics, as you'll see here. It's important, you see step 4, that's an area to wait for vaccination that sometimes is overlooked. But these are just examples of the many resources that are available at CDC's website, including CDC's communication materials for vaccine promotion as well. So with that, I will end. Next slide, please. So in conclusion, influenza vaccination really can have tremendous impact in reducing doctors' visits, hospitalizations, and deaths every year. But influenza vaccination is especially important this year because of the pandemic, and particularly among our most vulnerable populations. So those that are high-risk conditions and groups disproportionately affected by flu and COVID-19. And lastly, I want to end, as I said before, please ensure that your partners and your providers are continuing to offer vaccination throughout the duration of the flu season. Next slide, and I think that's it. Thanks, Jill. I'll hand it back to you.
Thanks so much, Sam. I do have one question that I thought I might just ask you that has come in, some of which I think maybe you covered, but there's a question about if we know current flu vaccine uptake. Do we know current flu vaccine uptake this season? And could it be possible that the increase in COVID diagnoses is somehow related to low flu immunizations?
I don't have the current flu vaccine uptake right now. CDC will be releasing that information. CDC uses a number of data to provide that information, including vaccine registries, but also surveys, but also billing data. Now, because of people's health-seeking behaviors, that may have impacted some of the flu vaccination coverage, but it also may have impacted providers' sort of behavior in reporting their flu vaccination. But it should be available on CDC's website. I believe soon. If not, it may be posted already, but I believe it's not available yet. And was there a second part of the question?
Well, it was just whether it's possible that an increase in COVID cases could be related to low flu vaccination.
I do think it's possible, but I think as far as we can hammer the message, I think the increase in COVID-19 is important. Flu vaccination becomes even more important than ever. We really need to find opportunities to not only reduce the burden that flu itself has, but reduce the burden that we're putting overall on the healthcare system.
Great, thanks so much.
Thank you.
And now we will turn it over to Jamie Snyder to talk about Arizona's approach to flu vaccination. Jamie?
Thanks so much, Jill. And Dr. Greatser, thank you for that fantastic overview of the national landscape. I'm going to talk a little bit about what we're doing in Arizona to address some of the barriers that Dr. Greatser identified in his presentation. So if we can go to the next slide. To start out, just wanted to level set a little bit about Arizona's Medicaid program, which is known as Access. We are the largest insurer in the state. We now cover over 2.1 million individuals. We've seen some pretty dramatic increases in our enrollment over the course of the last 10 months. Clearly, we're funded, as is every Medicaid program in the country, through a combination of funds, federal, state, and in our case, county funds as well. We covered more than 50% of the births in Arizona and 2/3 of the nursing facility days. We also have over 98,000 registered providers. And while Arizona was the last state in the country to join Medicaid, we were the first state to implement a mandatory managed care program. So for the bulk of our population, we contract with managed care organizations to administer the benefit on the agency's behalf. And that'll play into some of the steps we've taken around the flu vaccine in a moment. So you can go to the next slide. So the directive around the flu vaccine really started at the top. Governor Ducey came out early, and I have a statement here where he simply stated, the overlap of COVID-19 and flu season presents a perfect storm, and we aren't taking any chances. We are approaching this fall with a proactive mindset and plan of action to limit the impact of the flu and preserve hospital resources. I urge all Arizonans to get their flu shots. It's never been more important to do so. So the charge came to us from the governor's office to develop a three-pronged strategy that really seeks to incentivize member behavior and engage providers in order to influence vaccination rates in the state. And as Dr. Greatzer said, we do have some opportunity, even outside of this perfect storm that the governor mentioned, to really move the needle in terms of vaccination rates in the state. Next slide. So the first of the three prongs had to do with a policy change within the state's Medicaid program at Access, where we implemented an allowance, allowing pharmacists to administer the flu vaccine to children ages 3 through 18. We haven't within the program historically done so. We haven't allowed pharmacists rather to administer vaccinations to children. We have done so, but specifically for the flu vaccine, and we continue to evaluate the merit of expanding that allowance. But there, as you can imagine, there are parties that have some real concerns about expanding the allowance beyond the flu vaccine and the potential impact on well child visits. So that's something we're still evaluating. For now, that allowance for pharmacists is specific to the flu vaccine. Pharmacies, in order to make it a little easier for pharmacies to bill for the administration of the vaccine, we are allowing them to do so through our managed care organizations or health plans, PBM, or to work through the Vaccines for Children program. And that just opens it up beyond the VFC program for those pharmacies that are not already enrolled with the program, allowing them to go the kind of traditional route in terms of billing. And one thing that we were clear about from the onset, and we did get a number of questions on this front, is whether MCOs or health plans would be required to open up their network to allow any provider to administer the vaccine. And we made a decision at the onset that the MCO network requirements would remain intact. In other words, the MCO is only required to reimburse for the administration of the vaccine for their enrolled providers that are in network with the health plan. Next slide. We also, the second part of our three-pronged strategy was to offer a provider incentive to really ensure maximum engagement of providers in offering the flu shot. So we are offering a 10% rate increase for in-office flu vaccines and administration codes and pharmacy flu vaccine codes. And I will actually, subsequent to my presentation, I will place a link in the Q&A space so you can have see an actual guidance document which outlines all of the codes where we're offering that 10% rate increase. One of the questions that we received right away was whether we would offer that rate increase if the vaccine was administered through drive-up or mobile environment. And we stated very clearly at the onset that, of course, we would offer that rate increase for those for vaccines administered in those types of settings. The key is that the provider, again, must be registered or enrolled with the Medicaid program with Access, and then in network for the health plan in order to be effectively reimbursed at that higher rate. Next slide. And then one of the most important parts of our three-pronged strategy and the third leg of the stool was offering a member incentive. We have, and our health plans have historically seen a lot of success when they've offered member incentives for specific types of behavior that we're trying to drive within our population. And so all of the health plans are required to offer a $10 gift card to members enrolled in managed care who obtain the flu vaccine. And that's not $10 per family, it's $10 per individual. So if it's a larger family, clearly that could be a pretty substantial incentive on the member side of things. The gift card is provided just from an operational perspective after the flu vaccine is administered, and the the member is required to coordinate with their health plan. So one of the things that we've asked our health plans to do is to clearly post information on their websites on how to access the gift card for members enrolled with their plan. We have also developed a flyer that we've provided and disseminated out into the provider community, which contains contact information for all of the health plans, making it easier for the member to connect with their health plan about that gift card. And one of the questions, as you can imagine, we got on a number of occasions from different parties was whether we were going to mandate a certain type of gift card. And we are not. Pretty consistent with our approach more generally in terms of our delivery system and allowing managed care organizations to make those types of decisions. We are allowing them to determine what type of gift card they want to offer to members, but clearly we are placing the restriction on the use of gift cards and not allowing those gift cards to be used for the purchase of alcohol or tobacco products. Next slide. And we've been coordinating, as I mentioned, the governor issued a very clear directive to the agencies, state agencies around working in whatever way that we could to incentivize citizens throughout the state to obtain the flu shot. So we've worked not only in partnership with the governor's office, but clearly with our public health department. And the public health department implemented a pretty aggressive media campaign. And this is just one of the images that we're seeing on television. We're certainly advertising on our website, as are other state agencies throughout the state enterprise. So just wanted to note that we had the very sort of clear-cut three-pronged strategy, but we're working in partnership with other state agencies and the governor's office to ensure that we're being as effective as we can in addressing what the governor deemed to be the perfect storm. And I think that concludes my presentation, but I'd be happy to take any questions. I'll turn it back to Jill.
Thank you so much, Jamie. Appreciate it. And now we will turn it to a presentation by Dr. Ezike. And as I mentioned earlier, she was called in to brief the governor, but we do have her presentation recorded. And so we'll go to that now.
My name is Ngozi Ezike, Director of the Illinois Department of Public Health, and I want to share the IDPH response and activities to increase influenza coverage levels. So we will have the immunization section use the CDC influenza supplemental funds in the amount of $4.3 million to increase the influenza coverage levels and respond to influenza-related health inequities. So these funds will increase the capacity of existing partners, as well as identify new partners and new vaccinators for this important effort. So there are several projects that we will be funding, and the first project is really just foundational around health equity, and this is by implementing a community-led approach to health integrated concepts that respond to the social determinants of health and health equity. So we know that we need a diverse task force to engage all sectors of our community. The goal is to empower, mobilize, and educate the targeted communities, many of which are at highest risk of having the flu and having flu-related complications. And hopefully with this foundational groundwork, we can lay the fabric together so that we can go forward with additional issues and already have the community trust and the community support as we venture into other areas. Another project involves coverage level grant amendments. So we are going to work with community-based organizations that we already have partnerships with and amend their grant. And they are to identify additional organizations that are actually the grassroots organizations that have the relationship with these minority communities, that have the connection, so that we can appropriately reach out to these disproportionately low coverage areas and get those rates up. So these are groups that already have connections with churches and other communities that will help reach out to the communities of interest. Another project is the reaching out to the southern region of the state. The southern region also is disproportionately covered in terms of immunization rates and flu rates, and specifically the minority communities within the southern region. So we will be engaging in partnerships with community-based organizations that will serve specifically the minority communities in our southern region. Again, with the same goal of educating, empowering, and mobilizing the minority communities so that we can vaccinate for influenza. Remembering that the issue is not just about access. You may have plenty of vaccine, plenty of supplies, you have all the syringes, you have the refrigerators, but you also have the issue of either bringing people to the place where the vaccination can occur, or you can take the supplies to the community. But that is not even enough. We also need the people who you're trying to immunize to want the vaccine. And so the assumption is that you have this resource and the people want to have it, but that's not the case always. And so being able to work around the issues of mistrust, misinformation, myths that may be out there, those are important, that's important foundational work that also has to be incorporated into any plan to increase vaccination rates. And so in terms of bringing the vaccine to hard to reach communities, we do have this WOW mobile, the Wellness on Wheels mobile, which is available to our local health departments and really to any entity that wants to use this valuable resource to help get vaccines and supplies to non-traditional locations so that you can create these temporary mass vaccination clinics. We are providing each of our 97 local health departments an additional $20,000 each to get the preparation supplies so that if they sign up and contract to use the WOW mobile, that they will have all the things necessary to transport the vaccine to the sites of interest. Again, we talked about how important it is for the public that you're targeting to actually be interested and want to receive the resource, in this case, the flu shots. And so again, reaching out with ads, media and mass transit ads for flu shots will be targeted in these low coverage level communities. The hashtag sleeve up, that's the CDC's tagline. And so we're really just trying to get the word out to Illinoisans that, look, we're in the middle of a pandemic. We know everyone's talking about COVID-19, but what we really don't want to see is this twin-demic where we are dealing with both COVID and influenza at the same time, or in the same patient, which obviously would be worse than having either alone. So we are making sure that we get this some of these graphics and other pictograms out there to just remind people that it's flu season again, and the way that we combat the flu season is with the flu shot. And of course, if we are really going to increase rates above what they are now, we will have to reach out and have additional hands on board. The Project 6 involves the recruitment of the additional vaccination nurses. So field nurses will be contracted to staff and support existing local health departments and other vaccinators at these mass vaccination influenza clinics throughout Illinois. Again, we need to have the resource, the flu shot. We need to have the supplies, the needles and the alcohol pads. We need to get people to the site or take it to them, but then we also need the medical staff to help get that resource in the arms of the desired population. And I think that ends my presentation. Thank you.
And Jill, I would be happy to answer the questions that have come in regarding the match rate, as well as gift card incentives within a fee-for-service construct, if you'd like me to.
Oh, that would be fantastic. And I think at this point, we are ready to move to questions. So if the panelists want to turn your cameras on, and for those of you who have questions and haven't yet put them in the Q&A, feel free to start doing that now. So that'd be great. Why don't you go ahead, Jamie?
Sure. So one of the questions that came in related to the federal match, if and whether federal matching dollars were available if you were to offer the gift card incentive within a fee-for-service program. And so that's a great question, and a question that we began exploring when we decided to offer the member gift card incentive on the managed care side of things. And so we did have a fair bit of communication with CMS, and CMS's final indication to us was simply that the federal match is available for that gift card incentive in the fee-for-service, because we have about 122,000 members in our fee-for-service program. In a fee-for-service program, provided that the state meets all CMS requirements. So we're actually now working to frame our gift card incentive within that fee-for-service program, that smaller fee-for-service program that we maintain, and working to ensure that we're checking all the boxes on the CMS side of things, although they weren't any more detailed than that. They simply stated that we needed to ensure that we meet all the requirements that they've established. So we're working to put a proposal together for them right now. And then I think the other question was around what match rate is available for the flu vaccine. And so as you all know, each state's federal match rate is different. But in Arizona, what I can tell you, and this will give you some context in terms of how it will play out, is our standard match rate sits around 70% fed. Of course, with the Families First Act that was passed early on in the pandemic, all Medicaid programs were offered an additional 6.2 percentage points in federal matching funds. And I believe all states have taken advantage of that, as you can imagine. So right now, our federal match rate sits at just over 76%, and that's available to us for the vaccine and the administration of the vaccine as well.
Great, thanks so much. While folks are thinking about questions, I was able to pose one question to Dr. Ezike, and we have her response. And Jamie, you may want to answer this one too. So the question was, how do you expect the flu vaccine campaign to influence plans for the COVID-19 vaccine messaging and administration? And so we can start with Dr. Ezike, if that works.
Traditionally known of the vaccine hesitancy or the mistrust of vaccines, some of that relating back to some really unfortunate periods of our history associated with public health and communities of color, namely, I think of the Tuskegee syphilis experiment. And so we have a large portions of some of our high-risk communities that are concerned and still have many messages out there that say that the flu shot will actually give you the flu. I've even heard, as this relates to the COVID vaccine, I've heard people say that they won't take the flu shot because they heard that there's COVID virus has been added to the flu shot. And so a lot of the groundwork game, the foundational work, has included the focus groups that we have had to have with the communities to hear these concerns, to hear what the thoughts are, to hear what the barriers are, and then be able to address them. We've learned from these focus groups that we have to show trusted messengers from the community, whether it's them taking the flu shot in a very visible public way, and we're planning some of those events, whether it involves hearing from church leaders and people directly from the community, being the credible messenger to say why we need this vaccine. And so we're going to use the information that we've learned from talking to the community and responding to their concerns and apply that also to the COVID vaccine, and understanding that there are differences when we're dealing with those two vaccines. We do, but no matter what the message is, we obviously need to give the community just the full, straightforward information that we have. And we know that we have been with this flu shot for decades and decades, so we know the safety. It's been given to hundreds of millions of people. We know the safety profile, and so we're really, using that knowledge to try to push that, and understanding that our message will be a little bit different with the COVID vaccine, that we don't have the extensive knowledge, and we have to share what we know and what we're able to say, and give what the risk-benefit analysis is, and then allow people the space and the ability to make the best decision for them, but just making sure that they have all the appropriate information with which to make that informed decision.
Excellent, thank you. Jamie, would you like to share your thoughts about it in Arizona?
Yeah, I couldn't have captured it any better. I think that was a great summary, and many of the interventions we're employing are similar. So no, I think she did a great job responding.
And this is Sam. I just want to add, I agree completely. This is going to be particularly challenging, but particularly important this year. I think the practice of flu vaccination in itself, because COVID-19 vaccine, just the process is complex itself, and the vaccine appears to be a complex vaccine. Beginning the steps and even having providers practicing these clinics, these are different clinics. I mentioned multiple times the need for social distancing, the need for masks in these clinics, a different structure. As much as we can get this structure in place, and even though flu vaccine is recommended for all ages, practice the targeted outreach to the populations that are likely going to be targeted for initial doses of COVID vaccine. So your healthcare workers, people that are the groups that are disproportionately affected by COVID-19. The flu vaccination is a real world opportunity to improve the procedures and the processes.
Great, thank you. I mentioned at the beginning about the risk for pregnant women, both for women and for potential impact on the mother and baby after birth. I wonder if you could talk at all about efforts underway to increase flu vaccine among pregnant women. And that's for either or both of you.
Yeah, I can only speak generally. I know that's a big focus for the for CDC this year, is reaching pregnant women. I know there are some communication material available as well. I know that probably Jamie and others can talk to more specific. A lot of times, while there's a national approach to communication, ultimately it's at the local level. It's the provider getting the strong provider recommendation makes the longest impact in really getting coverage increased.
Yeah, and Jill, as I mentioned, our efforts have been really around incentivizing the entire population. We did, of course, not on the pregnant women's side of things, but certainly in terms of ensuring that children have ready access to the vaccine, and families, we did offer up that protocol change where we're allowing pharmacists to administer the vaccine to children.
Great, thank you. And that actually segues into a question that we got about the new rule that the HHS rule that allows pharmacists and pharmacy assistants to participate in VFC. I would imagine it might be early, but is there any evidence or data to suggest whether that's affecting flu vaccine uptake?
I think that's for me, but I don't have any evidence at this point. But Jamie, I don't know if you have any more at the state level.
No evidence at this point, but what I will say, consistent with the presentation, is for the flu vaccine in particular, we are allowing pharmacies and pharmacists to bill through the health plan PBM or work through the VFC program. And that's really to ensure for those pharmacies and pharmacists that aren't enrolled with the VFC program currently, it can be a bit challenging, a bit cumbersome, that they have an easy path for billing. But I do think in a perfect world for tracking purposes and so forth, it would be great if there were an easier path to enrollment in the VFC program.
Yeah, that's a great point. I think one of the things that I mentioned earlier with our current project working with 5 states is that there's both Medicaid agencies and public health departments participating in those projects. And we purposely planned this webinar to have a Medicaid perspective and a public health perspective. And I'm interested, Jamie, if you might be able to talk about in Arizona how Medicaid and public health programs coordinate or collaborate in order to increase flu vaccine uptake.
That is such a great question, Jill. Clearly in Arizona around the flu vaccine, the governor really issued the edict and said, state Medicaid agency and public health department need to coordinate around your overarching strategy. So that's why we've really worked in particular with some of the promotional work that they're doing to advance that effort through our managed care organizations and having our managed care organizations work with providers as well. So we've worked really well and hand together in terms of this overarching strategy around the flu vaccine. But I think that points to a bigger question. Your question points to even a bigger question around coordination. And we've seen, some of those challenges emerge when you have an event like the pandemic, right? And your Medicaid agency and your public health department don't sit in the same space. They're not under some sort of umbrella organization. We have historically worked really closely with our public health department. So we feel like we are at an advantage in that regard. But I definitely have heard from some of my peers in other states where it is the case that the two agencies sit in different places, that it's been particularly challenging. And so I think, as we look at lessons learned from the public health emergency and the pandemic, one of the areas we really do need to focus some energy on is how we can better coordinate around the response effort. And so we've been talking I'm on the board of the National Association of Medicaid Directors, and we've been talking a lot lately about how we can work with our federal partners and advocate through the National Association for attention to that very issue. So as we head into similar events, let's hope that we don't, but if I would imagine we will have events like this in our lifetime again. And so as we head into those events, to ensure that the coordination is really occurring within those states that have historically struggled.
Great, thanks, Jamie. Sam, did you want to add anything there?
I think Jamie captured it well, but I think coordination across all departments is important. We need to make sure we break down silos. One of the efforts this year that I didn't talk about in my presentation is CDC provided additional purchase of influenza doses to go through immunization programs. And the idea was that these doses to be used by community health centers to reach groups such as those at high risk with high risk conditions and essential workers. So we're hoping that those additional doses lead to increased collaboration, not just this year, but down the road.
Great, thank you. So I'm curious whether you have any lessons learned that you would want to share with other policymakers. So if other states were looking at coming to you looking for suggestions on how to run an effective campaign for a flu vaccine, what would come to mind?
Yeah, I would say from my perspective, and one of the questions was targeted at this. I get out of the gate early around setting up a program in your fee-for-service program that is comparable to what you're doing in managed care and working with CMS closely. Clearly, we're just now really starting to establish that framework, and so I think that that's important to remember as you're working with our federal regulator. The other piece I would mention is I do think, and it sounds like other states are doing this to a larger degree, I think it's really important to target some of your efforts to those populations that may have more challenges in terms of accessing the vaccine. And you can, pretty quickly identify, which populations will struggle more in terms of obtaining the vaccination or obtaining the flu shot. And I think to have targeted campaigns for those populations is really important.
Yeah, I couldn't, I'm going to add I couldn't agree more. I mean, I think this concept of partnership and working across all your programs, it may be that the groups in chronic health are important to collaborate with. And one of the groups that we're working with this year are the REACH programs, the racial and ethnic approaches to community health. And these programs have a number of successes in addressing HIV issues. And so we're trying to use these groups also to address immunization issues as an important healthcare component as well too. So these are just examples of collaborations that might be good examples to you.
Excellent. That's great. That's really helpful. Thank you. We have a couple slides remaining that we want to make sure we share. So next step. So we have a few resources that we've included if you were interested, and want to point out that NASHB and Academy Health, we're seeking 5 to 7 new states for a new community of practice on eliminating barriers to immunization through collaborative use of state agency resources. This is funded by a CDC cooperative agreement, similar to what the 5 states that I shared previously have done. And if you are interested, there's a link to the application. You can also follow up with us afterwards with Rebecca or Sunita, who are listed here. We'd love to have you join us if you're interested. And also, I want to make sure to ask if you would please fill out the evaluation form that you will see when the webinar concludes. Your feedback is always helpful to us so that we can tailor our resources to topics of most interest to you. And then finally, many thanks to our panelists. I want to thank them all for participating today, for sharing their time and their expertise, and thank the CDC for sponsoring the webinar, and also thank Academy Health and Immunize Colorado for partnering with us on this work. The webinar slides and recording will be posted to nashb.org, and thank you all for joining and have a great day.
Thanks, Jill.
Thank you.